First, let me give an update on the latest data that we have on coronavirus. And I can report that through the government's ongoing monitoring and testing programme, that as of today, there have now been 1,383,842 tests for coronavirus across the UK, including 84,806 tests yesterday. We know that 194,990 people have tested positive, and that's an increase of 4,406 cases since yesterday. And of those who have tested positive, 29,427 have very sadly died. And our hearts go out to everyone who has lost a loved one throughout the coronavirus challenge. We continue to see evidence of a flattening of the peak of this virus, but as the figures that I've just read out show, it's not over yet. So in the coming days, SAGE will update ministers with their latest scientific advice. And as ever, we will make sure that we continue to be guided by their advice as we take the decisions on next steps in fighting this virus. Alongside the advice that we get from SAGE, our 5 tests remain absolutely key. First, we must continue to boost NHS capacity so that the NHS cannot be overwhelmed. Second, we need to see a sustained and consistent fall in the number of deaths. Thirdly, we must see further reductions in the rate of infection to manageable levels across all different settings and areas. Fourth, we must be confident that the NHS will be able to cope with future demands, including as a result of any changes that we make to existing measures or indeed any new measures that we might wish to take. And fifth, and above all, we need to be confident that any adjustments to the current measures won't risk a second peak of infections that could then overwhelm the NHS. Later on this week, the PM will update the country on the measures and the decisions that we will need to take to protect the NHS, to safeguard the economy, and to avoid the risk of a second peak that will be damaging both for public health but also for jobs and the wider economy. And as we consider the decisions that we will take next to protect life but also to protect our way of life, it's now clear that the second phase will be different. We will need to adjust to a new normal where we as a society adapt to safe new ways to work, to travel, to interact, and to go about our daily lives. We've never experienced anything like this first stage of COVID-19 in terms of the scale of the lives lost, but also the lockdown that it has required. And as we go forward, we want to make sure that the next phase is more comfortable, is more sustainable, and prevents lasting damage to jobs and livelihoods. But we need to be under no illusions. The next stage won't be easy. And if we're going to protect life and preserve our way of life, as I just said, we must continue to be guided by the scientific advice we receive and make sure the next steps that we take are sure-footed and sustainable. Now, before I hand over to Angela to run through the data slides, I want to provide an update on one further feature that coronavirus as a challenge has thrown up for this country and indeed for the whole world. Whilst the vast majority of people and countries have come together and rallied to this international mission to defeat coronavirus, there will always be some who seek to exploit a crisis for their own criminal and hostile ends. We know that cyber criminals and other malicious groups are targeting individuals, businesses, and other organisations by deploying COVID-19 related scams and phishing emails. And that includes groups that in the cybersecurity world are known as advanced persistent threat groups, sophisticated networks of hackers who try to breach computer systems. And we have clear evidence now that these criminal gangs are actively targeting national and international organisations which are responding to the COVID-19 pandemic, which I have to say makes them particularly dangerous and venal at this time. So we're working with the targets of those attacks, with the potential targets, and with others to make sure that they're aware of the cyber threat and that they can take the steps necessary to protect themselves or at the very least mitigate the harm that could be wrought against them. So with that in mind, Today, the UK's National Cyber Security Centre and the US Cyber Security and Infrastructure Security Agency have published a joint warning about these groups, and we've offered some advice on the cyber criminals and other actors who are seeking to exploit COVID-19 through malicious cyber activity. Our teams have identified campaigns targeting healthcare bodies, pharmaceutical companies, research organisations, and also various different arms of local government. Now, there are various objectives and motivations that lie behind these attacks, from fraud on the one hand to espionage. But they tend to be designed to steal bulk personal data, intellectual property, and wider information that supports those aims, and they're often linked with other state actors. Now, we expect this kind of predatory criminal behaviour to continue and to evolve over the coming weeks and months ahead, and we're taking a range of measures to tackle that threat. So, as we've done today, we'll share advice on the nature of those threats to enable businesses, citizens, and our international partners to better defend themselves against the full range of cyber attack, from hostile states to criminal gangs. Preventative action is often the very best way to deny attackers the opportunities that they're looking for. The National Cyber Security Centre offers a range of practical advice to safeguard against cyber attacks, from things like using the use of online passwords to guidance on what are the trusted sources of online information related to COVID-19, like the gov.uk sites or Public Health England. Now, as well as providing practical advice, the UK will continue to counter those who conduct cyber attacks, and we're working very closely with our international partners to respond to the threats, but also to deter the gangs and the arms of state who lie behind them. We're absolutely determined to defeat coronavirus and also to defeat those trying to exploit the situation for their own nefarious ends. And with that, I'll pass over to Professor McLean to give us the latest update on the data.
Thank you. If I could have the first slide, please. So the first slide reminds us what are the 5 tests for adjusting lockdown. And number 1 is that we should always ensure that the NHS has enough capacity, that it's able to provide critical care and specialist treatment right across the UK. The second is that we should see a sustained and consistent fall in daily deaths from coronavirus. And the third is that there must be reliable data to show that the rate of infection is decreasing to manageable levels right across the board. Fourth is that operational challenges, including testing and PPE, must be in hand with supply able to meet future demand. And fifth is that we should be confident that any adjustments that are made to current measures will not risk a second peak of infections that overwhelms the NHS. If I could have the next slide, please. So this is a slide about transport use and how it's changed in Great Britain since February. So those percentages are relative to normal use during February. And the vertical dotted line is the date when lockdown started. And what you see is that for public transport, there has been a very marked and very persistent fall. So that's for bus, for tube, for National Rail, and also in grey further back for buses in London. For motor vehicles, so that's the top dark blue line, what you see is a pattern that looks a bit like commuting because it's low every weekend. And we do worry about that creeping up. I think all of us remember that what we've done together, which is to stay home, has worked to protect the NHS and save lives. And as one of the people who looks at this data and thinks about how it fits into how we think about the future, it does trouble me that the dark blue line is creeping up again. Next slide, please. This is the number of tests that have occurred every day in the UK since the 6th of April, up until the most recent data, which are from yesterday. And what you see is that very dramatic rise that happened during April, so that now we do have a lot of tests available that allow us to design the kinds of testing strategies that we're going to need in the future. Next slide, please. This is one of the ways we have of counting how many people in the UK are infected. So in two colours here are people who have tested positive. In dark blue are people who are tested by the NHS, and in orange are people whose tests were performed by universities, research institutes and private companies. So most of the people in the dark blue pillars there are either patients or NHS staff, whereas most of the people in the orange pillars are other key workers. And this data is extremely interesting, but it is quite susceptible to the fact that the number of tests has been increasing and who's allowed to have a test has also been changing. So actually, I find the next slide a lot more informative. So what this is the number of new inpatients in hospitals in England every day with COVID. So this is every day since the 20th of March, either in dark blue, an inpatient who was in hospital and got back a COVID positive test, or in gold there, somebody who arrived at hospital having already tested positive. So this is always the same kind of people, and these people were always the top priority to get a test. So in some sense, this is a much more pure data stream than the one I showed you before. And in fact, to my mind at least, makes much more sense. So what you see is that number rising from the 20th of March until it peaks on the 2nd of April. Now, the 2nd of April is about the date we would have expected it to peak, because that's about 10 days after the 23rd of March, when lockdown came in. And then from the 2nd of April, it falls away pretty rapidly. So what this is the inflow into the hospital system of people who are COVID positive. And we watch this number with great care every day. If I could have the next slide. So if that was the inflow into the hospital system, this is the total number of people in hospital with COVID on any given day. So that's really the balance between people who came in and people who left. And so that has a rather smoother pattern and a much slower fall. And what you see is that that peaked around about the 10th or so of April in London, that the peak in London was much higher than everywhere else, perhaps very slightly earlier, and the fall in the number of people in hospital in London has been faster than everywhere else. So much so now, actually, that in the last couple of days, the number of people in hospital in London now exceeds numbers in hospital in the northwest. Next slide, please. This keeps track of the proportion of critical care beds that are occupied by patients with COVID-19. And what you see is that that also has fallen from its peak in early April, now down to less than a third of all the critical care beds being occupied by COVID-19 patients. It's been decreasing for most of the UK over the last 2 weeks and is beginning to come down to what one might define as more manageable levels. Next slide, please. These are recorded deaths from COVID-19. In blue bars are the actual numbers reported each day. So today, being the 5th of May, we got Monday's figures in. And you can see there's a very regular pattern that numbers at the weekend are always lower than the days subsequently. So that jump from the 4th of May to the 5th of May is something that we would expect. Because this data has such a strong pattern across different days of the week, it makes sense to look at a 7-day rolling average. And that's what the orange line is. And what you can see from that orange line is that the number of COVID recorded deaths is falling and has been falling steadily since the middle of April. Next slide, please. This records registered deaths from COVID-19 by the place where that death occurred. And we've got it for 5 different weeks. And the most recent week for which we have this data is the week of the 24th of April. The grey bars are deaths in hospital. The dark grey bars are deaths in care homes. Pale blue is deaths in one's own home. And dark blue is other places. And what you see is that whilst deaths in hospital have been falling, deaths in care homes in the week to the 24th of April were still rising, to the extent that in that week, deaths in care homes were about half as many as all the deaths in hospitals. I think what that shows us is that there is a real issue that we need to get to grips with about what is happening in care homes. The final slide for today is a comparison of numbers of deaths for different countries. The UK, which is COVID deaths in all settings, is the grey line in the middle there. And what you see is that deaths in the UK is still continuing to climb and is higher than we would wish, I think is all I can say.